Hey everyone, welcome back to Nurse Crit. My name is Jason. I'm an acute care nurse practitioner. Nothing gets the adrenaline surging like a call from someone that says, "Can you come see this patient? They don't look so good." Whether you're a rapid response nurse or a home health nurse, we all need to be able to rapidly assess a sick patient. In this video, I will teach you how to perform a karate assessment. The objective of this video is to teach nurses how to rapidly assess a deteriorating patient without using any tools or equipment. You're probably wondering what I mean by karate assessment. In case you're not familiar with karate, it's a Japanese martial art that is translated to mean empty hand. In the hospital, we have access to tons of equipment: vital signs machines, EKG monitors, stethoscopes, x-rays, ultrasound, CT scanners, etc. But let's pretend that none of this is available. How can you assess a patient empty-handed? Well, remember back in nursing school when you had to take a physical exam class? Well, they taught a ton of things, most of which you probably thought were irrelevant, and perhaps a lot of it was. But the concept of the physical exam is still very useful. Just look, listen, and feel can really help us determine how sick a patient is and what steps to take next. Let's say you're a med-surg nurse caring for 5 patients. Your CNA calls you because when checking your patient's vital signs, the blood pressure is 86/58. Oh my gosh, should we panic? Call an RRT, call the physician? It's been a while for me, but I'm pretty sure the NCLEX answer would be to assess the patient first. First and foremost, try your best to keep your emotions in check. I know once the adrenaline starts flowing and your heart is racing, it's easy to panic and start making bad decisions. The first part of the karate assessment is to evaluate your patient from the door. This is your initial impression of the patient, and this alone can give you a lot of information. I know as a new nurse, you probably have to be more systematic and methodical, but after years of experience, you start to automatically make observations and collect information all at the same time. Your brain kind of takes a snapshot and you can immediately identify everything that's wrong or abnormal. So getting back to our hypotensive patient, when you arrive at the room, just pause for a second and create a mental snapshot of what the patient looks like. Some people call this the eyeball test, but for me personally, I prefer to use the informal LLS score. If you haven't heard of this before, this is the looks like shit score. If the patient looks like shit, that's a score of 1, and you probably better get some help pretty quickly. If the patient is not in distress, that's a score of 0, and maybe the patient's hypotension isn't too problematic. This is why physicians frequently ask if a patient is symptomatic when the nurse reports an abnormal vital sign. Not all abnormal values cause problems, and we use signs and symptoms to help us determine if a patient is sick or not sick. Now, I know the LLS score sounds pretty subjective, but for the experienced nurse, they can intuitively interpret that mental snapshot to make that determination. If you are someone who is less experienced or someone who relies on mnemonics, you can remember to laser in on the patient. For your initial impression, you should be observing the patient's level of consciousness, activity, skin, expression, and respirations. The patient's level of consciousness should be fairly obvious. Are they awake and alert, or are they lethargic or even unresponsive? If you determine that they are unresponsive, you skip the whole karate assessment and stick to the fundamental ABCs and call a code if necessary. For activity, is the patient lying comfortably in bed, or are they restless and agitated? Are they leaning forward to breathe? Are they in some other unusual posture or position? Skin is a remarkable tell of illness. When you look at the patient, what color is their skin? Is it normal, or are they flushed, jaundiced, cyanotic, or pale? Is their skin dry, or are they diaphoretic? I know when I see sweaty and pale, I really start to get worried. The E is for facial expression. Is the patient's expression normal and calm, or are they wincing in pain? Do they have the face of fear or impending doom? Respirations are another very important indicator of illness. For those of you who approximate your respirations at 16 on all of your patients, this is the one time you should be accurately counting for at least 30 seconds. Both a high and low respiratory rate are bad and can indicate impending respiratory failure or severe metabolic derangements. Also, remember to assess for respiratory effort and if you can hear any adventitious sounds without a stethoscope. All of these observations should help you determine your LLS score. Once you have your initial impression, you can perform a more detailed exam, still without equipment, just using your empty hands. I don't have a mnemonic for this portion, but it seems logical to progress from top to bottom, starting with assessing the brain, then move to the eyes, arms, abdomen, and legs. First, we will assess the patient's brain to see if it's getting perfused and functioning properly. To assess neurostatus, we ask questions and check motor function. Start by calling out the patient's name and asking them a few questions. Hey John, how are you feeling? Are you having any pain? If the patient responds to their name being called, they're oriented to person. If they can describe how they feel, they are mentating and responding appropriately. If they can identify the pain, it may localize a problem and guide us where to investigate further. Next, you should ask the patient, may I have your hand so that I can check your pulse? This assesses their ability to follow commands and demonstrates limb strength in the arms. When you check for a radial pulse, the presence of a palpable pulse indicates the systolic blood pressure is at least 80. 80 isn't great, but it's probably still perfusing most of the body. You can also check for capillary refill time right after the pulse. Cap refill is helpful in determining distal perfusion and should be less than 2 to 3 seconds. While you are asking questions and feeling the pulses, you can be examining the eyes simultaneously. Even without a pen light, you can assess if the pupils are pinpoint, huge, or unequal. If the patient is lethargic, with pinpoint pupils and decreased respirations, this is a strong indication to give some Narcan. Since the karate exam does not use a stethoscope, there isn't much we can assess within the chest beyond the respiratory effort we observed from the door. So next we move down to the abdomen. Does the abdomen look abnormally distended? Palpate the abdomen firmly to assess for tenderness. Abdominal tenderness plus a positive LLS score or ugly vital signs could have an urgent surgical problem brewing in there. Lastly, pull the covers back enough to examine the patient's knees and feet. If you notice mottling or a purplish discoloration at the knees, you have a major problem. Also check the temperature of the skin on the feet. Cold feet and mottled knees are a sign that blood flow is poor and the patient is in a shock state. If the patient is not already in the ICU, you should probably start moving them. And that is the head-to-toe karate assessment. Without using any equipment, you can very effectively determine how sick a patient is and possible causes of their instability. Obviously, in the hospital, a whole battery of tests will be ordered to diagnose and treat the patient. But maybe if you're outside of the hospital, this karate assessment can help you triage a patient and provide pertinent information to EMS. If you found this video helpful, please share it with your nursing friends and consider subscribing to my channel. Thanks for watching and see you in the next video.